Hi, my name is Dr. Adam Hahs. I'm the Chief Science Officer at Hopebridge Autism Therapy Centers. Today we're going to be answering some of the most commonly searched questions about ABA therapy. I am a board certified behavior analyst at the doctoral level as well as a licensed behavior analyst in the state of Arizona. I've been a board certified behavior analyst for almost 16 years and really love the work that I do. What is ABA therapy? ABA stands for Applied Behavior Analysis. It's the science of human behavior leveraging the principles of human behavior to make socially significant behavior change. What does that mean in lay terms? Well, if we know the environmental factors that influence behavior, then we're able to move those around and influence them in ways that promote adaptive and functional behavior. Is ABA therapy only for autism? In short, no. The science itself gets its genesis from lab work and has since expanded to other spaces in which human behavior is important and impactful. Spaces like gerontology, spaces like organizational behavior management, medicine administration. So it's not idiosyncratic to autism because the principles of human behavior are applicable across a variety of different settings and contexts. Is ABA therapy evidence-based? To be evidence-based, you need a lot of data. And one of the things that ABA does as a science is accumulate a wealth of data to say whether or not our interventions are effective. And in doing so, that builds a body of literature or empirical work that says how impactful are the interventions we've selected as a science of human behavior on influencing a targeted response. And that's what makes ABA therapy, amongst other interventions, evidence-based. Is ABA therapy ethical? Yes. The Behavior Analyst Certification Board has set forth a code of conduct, a code of ethics that all practitioners within behavior analysis are to abide by. In doing so, they put guardrails around what good practice looks like, what potentially unethical practice would look like, and how to kind of operate within those parameters. One of the things that is maybe a more progressive approach to behavior analysis and the ethics therein is really a stance of listening. And in listening, we can then forge more understanding and empathetic responses to the concerns about the ethical practice of ABA. Once we do that, we're then maybe better able to move our science around in ways that are still empirically based, but also sensitive to topics like assent. And here at Hopebridge, we want to practice assent-based practices or institute assent-based practices. By doing so, we ultimately do better, right? And so while there may be certain players and certain entities within the space that have engaged in unethical practices, I think one of the charges that leaders in the space have is to ensure that our governance of the ethics of ABA is tight, is progressive, is iterative, to really listen first and then incorporate change as a function of what the consumer is saying, only making ABA better, which that's the end game, is to help everyone kind of rise to the best versions of themselves. And ABA is one of the mechanisms to do that. Understandably, every child's journey within autism is unique. If you want to learn more about autism and the care that we provide here at Hopebridge around ABA, you can ask your pediatrician or come to us at hopebridge.com.